welcome to this session of how to identify depression. We talked previously about a couple of symptoms that can be there in depression, but having a symptom essentially does not qualify that you have depression, just as having a fever essentially does not mean that you have dengue, because a doctor will not only ask you about fever but other symptoms as well. So it's always a cluster of symptoms which accounts or amounts rather to a particular disease. So the same thing happens in mental disorders as well. A cluster of symptoms together when happen, then that is defined as a particular mental disorder. Now there is a manual which is Diagnostic and Statistical Manual for Mental Disorders. It is in short written as DSM. Now this is produced by the American Psychological Association or APA, and they keep updating the DSM time to time as per the scientific discovery and progress. This DSM manual talks about what are the defining criteria for a particular disease, and it helps psychiatrists and psychologists to identify various disorders, or rather categorize the symptoms or issues that people are facing into different disorders. So we're going to use the same DSM criteria today to help you identify and understand a little more about depression. Again, this is absolutely not akin to a clinical diagnosis. For a clinical diagnosis, you have to go to a professional, which is either a psychologist or a psychiatrist, to identify and validate what you're facing is depression or some other issue. This is just for your personal understanding and also to help you become aware of if you or somebody near you is facing these symptoms. Now, what are the symptoms within depression? Of course, sadness, a profound sense of sadness, loss of appetite or excessive eating. So you may eat very, very little, or you may eat a lot, abnormally a lot. And third is you may feel a lot of fatigue the whole day. So feeling of tiredness, feeling like you don't have energy to do anything at all. Fourth, you may have an experience of mentally being foggy or cloudy. So, your mind is not able to focus or concentrate because you are continuously kind of feeling as if you just woken up and you're not able to process thoughts. This can also lead to a lot of indecisiveness. Fifth can be a feeling of guilt or hopelessness. So there is no particular reason, but you end up feeling a lot of guilt, you start feeling hopeless, you start feeling like there's no point to anything. Sixth would be a sense of no purpose or meaning to life, and it also leads to a certain level of suicidal ideation or suicidal thought. So whether you're thinking of a method of suicide or you're thinking of suicide as a concept, ending your life as a concept, this is also or can be also a symptom of depression. There is also a feeling of certain slowness. So your mind kind of is moving very slowly, and you can see this in the form of not being able to respond or react to things, or really moving slow, not having a lot of memory about something. You struggle to remember simple words. Sometimes you forget even simple words like a laptop or a pen, or sometimes you're not able to think through about what to do now. How do I have to make tea, so what do I need to do now? I'm not talking about essentially cognitive issues, but these are issues where you're just slow in your thought. The thought comes to you eventually, but it's just slower. All these symptoms could be there, or some of these symptoms could be there. Now, the diagnostic criteria is that you should experience at least 5 of these symptoms over a period of 2 weeks. So 5 symptoms out of all these in the same 2 weeks. So it's not like you experience fatigue at one point of time, you experience sleeplessness at another point of time, you experience excessive appetite at another point of time. No, this then doesn't become clinically significant. It is clinically significant when you experience 5 of these symptoms in the same 2 weeks or more. The second diagnostic criteria is that these symptoms should not be a result of alcohol or drug abuse. So, if you have alcohol excessively or if you are abusing drugs, then in this case you will have these symptoms as a result of these substances. If you have any kind of substance abuse issues, all these symptoms will be present because they typically slow the system, mind and body down. However, if they are not a result of any kind of substance that you are taking, then they become clinically significant. Another aspect is that these symptoms have to have a certain profoundness, or what we call they should be clinically significant. What it means is they will impede your ability to function normally. So, you will not be able to function as you used to. Now, whether it is not being able to go to work or perform in your job or business, or it is your inability to continue with your social life. So, inability to form relationships or maintain relationships, or it is your inability to do other things that you were otherwise doing, which could also include normal living. Like you may not even feel like getting up and brushing your teeth or taking a bath or eating. This is not laziness. So, at a point of time you may feel lazy and you don't feel like taking a bath today. But if this happens over a period of time along with all the other symptoms that we mentioned, then it becomes clinically significant. Sometimes in this though, we have also observed that some people can continue with life. They go to their office and they come back and they are functioning, but at the same time the other symptoms of depression exist. So, when we say that it has to be clinically significant, it doesn't only mean that a person has to go to work. If they are going to work, it's perfectly okay, because over a period of time we learn how to wear a mask or a personality. So, we continue working, or as a reflex we continue doing things that we are used to doing, but there is a lot of other symptoms, a lot of things happening within. This is why a lot of times you would have experienced that people tend to say that person seemed okay, but we got to know later that they are suffering from depression, or we got to know later that there was an attempt to suicide or suicidal ideation. The reason is because people tend to feel that there is something off, but they do not know how much off it is. So, don't go by somebody just smiling. It's not that a person in depression cannot or will not smile. For some people, yes, it may mean that they are not smiling. For others, it may mean that they are smiling, but within there is a lot happening. And for that, we need to have a deeper discussion with the person. So, in essence, depression is what the experience is within. Your inability to do things from within, the pleasure that you seek from things is not there. This becomes one of the key defining things of depression, that the things that were of interest, that gave you pleasure, that were that you enjoyed doing, you no longer enjoy those things anymore, right? So, if you or your friends or family or someone you know as your colleague or peers seems to exhibit these symptoms, please do go and consult a professional. You can also connect with us. We can put you in touch with the right people and help you to deal with this issue. I hope this video was informative. Thank you.